To meet one of the most critical healthcare issues of our time, malnutrition, the Academy of Nutrition and Dietetics is leading a partnership with Avalere Health and Abbott to expand the Malnutrition Quality Improvement Initiative, MQII. The goal of MQII is to advance evidence-based, patient-centered quality care for all those suffering from malnutrition or at risk for malnutrition.
New Hanover is an 800-bed hospital serving southeastern North Carolina.
The culture at New Hanover Regional Medical Center is extremely unique in my opinion. This culture allows us the freedom to say, we think we can make a difference here.
The Malnutrition Quality Improvement Initiative is a platform that gives you the building blocks to build your own malnutrition program in your facility.
Malnutrition is such an important part of plan of care because all the clinical outcomes are dependent upon how nourished the patient is.
Malnutrition is essential to all healing. If a patient is not nourished well, that patient's healing is delayed in every aspect of care.
Overlook Medical Center is 504-bed hospital, part of Atlantic Health System in New Jersey. Overlook Medical Center enrolled into MQII in 2018. We looked at our malnutrition diagnosis at discharge, and then we compared that with national surveillance data for malnutrition, and there was a significant gap.
Malnutrition was something that was not being really adequately captured. That really sort of pushed us forward into pursuing this.
One of the key things that got my attention was the idea that we were going to actually be able to utilize our electronic health records to actually impact our patients.
We've been involved in the MQII since spring of 2017, and we were able to really help leadership understand the importance that malnutrition brings to our patients and our organization, and especially to our community.
Malnutrition within our patient population was much more widespread than we thought. So in order to meet our mission of leading our community to outstanding health, it was a major factor we had to address.
I first educated myself with the MQII toolkits to kind of see what are the best practices. And the biggest was the nutrition-focused physical exam, which is assessing muscle wasting, fat loss, hand grip strength, and in combination with the meal intake history, gives a comprehensive picture of malnutrition diagnosis.
On the inpatient side, we've seen our diagnosis of malnutrition increase from 3% to just over 8%. With our clinical outreach dietitian, we've seen significant decreases in readmission rates and utilization of hospital resources. As a result of what we've been able to do in the past couple of years, we've been able to increase our staffing by 3 full-time dietitians.
As a result of our MQII efforts, we made a difference from 3.4% to 8.4% diagnosis rate for our general populations. And for older population, the rate is 13.7%.
We're preventing readmissions to the hospital. We're improving our patient experience scores. Our dietitians really have a renewed sense of professional purpose, and they have really embraced all of these initiatives that have come their way.
As a result of MQII, there's far more collaboration and there's far more appreciation for the roles that each of us play in the care of our patients.
With our Transitions of Care program for malnutrition, we have a clinical outreach dietitian that goes into the patient's homes within several days after discharge.
What I think the big opportunity right now is to make certain that we roll this out through the rest of the Atlantic Health System. And I think that Rajesh is going to be instrumental in doing that.
I'm working on bringing the dietitian's recommendations into the discharge instructions, as well as making efforts that this care move forward to transition of care.
We're developing a plan for them to leave here to continue them on their nutrition journey.
Any individual that decides to take this journey will not regret it.
When you get a chance to wipe out a major adverse factor for health, you just do it. And you get the people that are closest to the work to do that.
It's the right thing to do for the patient, and it's the right thing to do for the institution.
Through initiatives like MQII, we are together helping develop the healthcare models of tomorrow.